Well, when I qualified in 1980, I started as an oral surgery house officer in UK, and it was evident right from the start that oral surgery was a passion of mine. I had joined the Royal Navy, and when I went into the Royal Navy I had to do 2 years of general duties dentistry, which involved doing restorations, crowns, bridges, all the usual things that dentists do. I then was lucky enough to get some time in a Royal Naval Hospital, and so I got back into doing oral surgery. And it's something that I've enjoyed right from the start. I found it more of a challenge. I found it more satisfying than doing restorations and repairing teeth. Unfortunately, trying to get into oral surgery at the time was very difficult, and you had to go off to do medicine as well. And so I chose the path of the other surgical specialty within dentistry at the time in UK, was in the Navy, was periodontics, or the treatment of gum disease. And so I was lucky again to be selected and sent off for gum disease specialist training in London, which I did and completed. And that then took me to a series of jobs where I was located in a region and found myself not only providing a referral service to my colleagues in the military for gum disease treatment, but also I found myself doing more and more wisdom teeth for soldiers, sailors and airmen. And so I then discovered that my start in life in oral surgery was proving to be useful. Eventually, after 20 years in the Navy and 4 more years working for NATO in Germany, I decided to have a complete change, and we emigrated as a family out here directly to Townsville. I wanted to carry on doing the sort of clinical work that I'd enjoyed, but the reality was I had to do what was available, and so I went back to doing some routine general dentistry. But gradually, over the time that I've been here, the 13 years or so, 14 years, I've found that I've gone back to doing only what I'm particularly trained in. And having done a master's in periodontal treatment, it helps me provide the very best treatment possible in that area of dentistry. Having trained in oral surgery, and I did my membership of the Royal College of Surgeons in UK, I found that all the training I received while in the Navy has helped me there as well. Implants is something that I really became involved in Germany before I came here, and that was something that was very slow to take on in Townsville. I started providing implant treatment in about 2002 in Townsville, but I think I put in 7 implants or 8 implants in the first year. Now I would probably do that in a month or 6 weeks. It's a very different Townsville to the one that I arrived in, and patients expect more. And so I think, from my point of view, having the broad experience of the areas that we've discussed makes it possible for me to offer patients a better service. Implant treatment is very much 2 parts. One side is surgical and the other is restoring the implants once they're in the mouth. And again, it's sort of luck really for coming from a military background, but because of my postings and where I was, I found myself having to do both. So I was putting implants in and I was restoring them. So coming to Townsville, it's been a great opportunity for me to see patients and take them through their entire treatment right from the start. So it might involve just taking teeth out and waiting and then putting implants in and then restoring them, to more complicated cases where I'm taking several teeth out, putting in several implants, maybe with bone grafting, and then waiting and then finally restoring. And so we really do offer the full range of implant therapy, from single tooth replacements right through to the replacement of an entire dentition, upper and lower jaws, where patients have got false teeth but on implants or implant structures.